Good morning, Jen. I'm Annette from Recovery, and I'm bringing you this patient. I'm going to give you a report. Mrs. Jolie, are you awake? She was pretty. She was answering me in recovery room, but I gave her some morphine, and she's a little bit drowsy.
Okay.
So this is Angelina Jolie. She's a 50-year-old patient of Dr. Pitt's. She had a left radical mastectomy. She found a lump in a self breast exam a couple of weeks ago, and it was suspected to be cancerous, and her follow-up workup showed that it was. So she had the mastectomy. She has no previous medical history. She's had 2 vaginal deliveries without complication. Home meds is just ibuprofen PRN for discomfort. No known drug allergies. She did really well throughout surgery. Her vitals were stable. She's been in recovery for about an hour. Assessment-wise, she's been very stable. Her last set of vital signs were 110/60, pulse of 89, respirations 20, temp of 99, and her O2 sat on room air was 94%. She sat it a little higher when she had oxygen on. Since I brought her over here and she's so drowsy, I put the O2 back on. Her estimated blood loss in surgery was only about 200 milliliters, so not bad at all. In recovery, I gave her over a period of time 10 milligrams of morphine for pain, and she had 8 milligrams of IV Zofran for nausea. The last time I gave her pain medication, she was rating her pain at a 6 out of 10, all centered on the left side of her chest. She's still a little nauseated the last time, but she's been pretty drowsy now. She's been MPO, except I did give her a few ice chips because her mouth was so dry. Like I said, she was drowsy. She does arouse to verbal stimulation, or just a gentle rub on her shoulder, and answers questions appropriately, but returns to sleep pretty quickly. She had a Foley during surgery. We removed that about 10 minutes ago with an output of 200 milliliters of dark amber urine. She has a dressing to her left chest wall. There was no drainage on it, and I checked it right before I brought her over here. She has a Jackson Pratt drain as well, and I emptied that right before she came out to the floor, and she only had 5 milliliters of drainage in it. I suspect maybe she'll have a little more over a couple of days, but, and it was a sanguinous, pretty bloody. Our IV is lactated ringers at KVO, and otherwise on her assessment, I didn't find anything abnormal. You know, obviously she's got hypoactive bowel sounds because she was MPO prior to surgery, but pedal pulses are good, hand grafts are good, pupils are good, her monitor was good, nothing abnormal on her heart monitor. So I think she just needs her normal post-op assessments and routine vital signs that follow a post-op patient, and I do have standing orders for post-mastectomy from Dr. Pitt as well. Do you have any questions for me?
Is her family here with her?
Her family's in the waiting room.
Okay.
I told them that you needed to assess her and get her settled, and that you would come and get them when they were able to visit her.
Okay.
They saw her briefly in the waiting room, and the doctor or in the recovery room, and the doctor spoke to them.
Okay.
I'll be in surgery if you have any other questions.
Okay.
All right, thank you.
I'm good. Thank you. Ms. Jolie. Hello. My name's Jenny. I'm going to be your nurse today. I'm going to do a post-op checklist, so I'm going to take a look at your wound and ask you a few questions, okay?
Is my surgery over?
Your surgery is over.
Okay.
I'm
really tired.
I know. Sometimes that medicine that we have makes you really sleepy. All right, so I'm just going to start here with my post-op checklist, okay?
Okay.
So I'm going to write down the time and obtain a set of vitals. And my vitals are up here. I'm going to write these down underneath the baseline, because since she just came back from surgery, we're going to start there. So her temp is 37.6 Celsius, pulse is 76, respirations, I'm going to say are 20. Blood pressure, 120/78. Ms. Jolie, can you tell me your pain level right now on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain?
It's about a 4.
A 4. And can you tell me where it's located?
It's on the left side of my chest.
Okay. You don't have pain anywhere else though?
No, just my chest.
Okay. Okay, so I'm just going to start with the mental status, which is the first column on here. She's easily aroused and doesn't take painful stimuli or anything to awake, so I'm going to put AS. Ms. Jolie, do you have any nausea?
I am a little nauseated.
Okay.
Not as bad as it was before.
So the Zofran that they gave you in recovery helped a little bit?
I think so.
Did you have any vomiting?
No vomiting.
Okay. So no nausea, or minimal nausea, no vomiting. Okay, I'm gonna do some breathing exercises with you, and this is gonna help prevent any pneumonia since you're laying in bed more than what you probably normally do, and you're not taking as deep of respirations because of your surgery. We wanna make sure that fluid doesn't pool in your lungs. So what I'm gonna have you do is cough and deep breathe, and we're gonna have you do this with your post-op check on an hourly basis. So we'll be coming in a lot to have you do this. And you are more than welcome to do all of these interventions without us in the room. So what I'm gonna have you do is take some nice deep breaths in through your nose and out through your mouth, and then I want you to try to give us a good cough. If this hurts your either your chest or your abdomen when you're coughing, we can get you a bath blanket to put across to kind of hold some pressure on, and that might help you also. So let's do some coughing and deep breathing. In through your nose, out through your mouth. Let's do another one of those. And on the next one, I want you to give some good coughs. Good.
Oh, that really hurts my left chest.
Okay, we'll bring you in a bath blanket so you can help support that the next time you do that.
Okay, thank you.
Okay, and then would you like to turn to your side at all, or are you comfortable on your back to start with?
I'm comfortable on my back right now.
Okay, the next time
I'm afraid if I turn over, I'll get nauseated.
Okay, well the next time we come in, let's make a goal of trying to turn to one side or another so your bottom or back doesn't get sore.
All right.
Okay. Next Ms. Jolie, I'm gonna look at your dressing. Oh, your dressing looks wonderful. It's nice and dry. I don't see any spots of blood. I'm also looking at you have a drain. I don't know if you remember them telling you that in recovery. There's no drainage. There's no drainage in your drain, so we'll be keeping an eye on that too and emptying and recording that. Did not change the dressing. I'm not reinforcing the dressing. The JP drain is patent. And I know, Ms. Jolie, that they just took out your Foley catheter. Do you feel like you could go to the bathroom?
No, not right now.
Okay. We will want you to try to start going to the bathroom within 4 hours. And if you haven't gone within 8, we're going to call the doctor again. We want to make sure that since sometimes you have a Foley catheter, you get kind of irritated down there and you may lose some of your sensation that you have to go. Also, it may burn the first couple of times that you go. But it's really important that we watch how much urine you're putting out since you have an IV going and you just had surgery.
Okay.
Okay. And then I'm going to complete the rest of my post-op check. So I'm going to be listening to your heart and lungs and your belly, okay?
Okay.
Just going to listen to your lungs here. Deep breath in. Another one. Another one. Another one. I'm going to listen to your heart. Can you take a deep breath for me? And another one. Good. Listen to your belly. Are you passing any gas yet?
No, not yet.
Do you have any tenderness when I push on your belly?
No.
Okay. How about your IV? Are you having any pain in your IV?
No, that feels okay.
Okay. I'm gonna take a look at your legs. Can you wiggle your legs back and forth for me?
Yes.
We're gonna ask you to do this a lot too. That way you keep the circulation moving in your legs. Do you have any calf pain?
No.
Feeling for pulses here. Gonna have you push against my hands like a gas pedal. And then pull your toes to your nose while I give you some resistance.
Okay.
Okay. I'm going to get somebody to help me roll you over comfortably so that I can listen to the back of your lungs a little bit, so that way I can make sure that you don't have fluid back there. Your lips look a little dry, so I'll bring you in some ice chips.
That'd be good. My mouth is dry.
Okay, and I will also look to see when the next time you can have pain medicine is,
Thank you.
and also nausea medicine.
Oh, good.
Is there anything else I can do for you right now?
I need another blanket.
Okay, I will get you another blanket. I will also tell your family that they can come in.
Oh, thank you.
Okay. And I know the nurse before me oriented you to the room, so your call light is right here on the bed for you. Okay?
All right.
Feel free to let us know if you need anything.
Thank you.
You're welcome.
See them?